Have you ever imagined what you would do first if chest pain hit while you were completely alone? Every year, thousands of seniors are at home when their heart signals danger. Sometimes it's sudden and dramatic, sometimes it whispers. But here's the hardest truth. Survival in those first minutes often comes down to what you do immediately, not how old you are or how lucky you feel. This video is for you, for the men and women who live independently, for the neighbors who check in, for the children who worry from afar. On CoreHealth, we believe knowledge is power, and today we're going to give you practical, calm, step-by-step actions you can take if you ever find yourself alone and facing chest pain. These steps are simple, they are not glamorous, but they are the difference between having a fighting chance and letting precious time slip away. Listen carefully because I want you to picture this moment clearly. Imagine the first odd sensation. A pressure, a tightness, a heaviness that sits in the middle of your chest. Maybe you think it's indigestion. Maybe you tell yourself it's just a muscle. Maybe you sit down, hoping it will pass. That hesitation is exactly what can cost heart muscle its chance to survive. The advice I'll share is built from what cardiologists see again and again. Fast, measured action, clear breathing, sensible positioning, and getting help immediately. Stick with me all the way through. This is a long script because I want to give you not only steps but the reasoning behind them, the what, the how, and the why, so that in the heat of the moment your decisions come from preparation, not panic. Number 1, recognize the warning signs. Chest pain can arrive like lightning or like an unexpected rain that slowly soaks through your day. Not every heart attack looks like the movies. You won't always clutch your chest and collapse. For many, it starts as pressure, a squeezing, or a heavy weight right behind the breastbone. For others, it's discomfort that feels like indigestion, belching, or a dull ache that moves into the shoulder, arm, neck, jaw, or back. Some people feel nausea, lightheadedness, or a cold sweat. Shortness of breath, the kind that comes on for no clear reason, even at rest, is a red flag. If any of these symptoms appear suddenly or persist longer than a minute or two, treat them as an emergency. It's important to understand how symptoms can be different in older adults, women, and people with certain conditions like diabetes. Women and older adults often report milder or atypical signs, tiredness that feels different from normal fatigue, vague discomfort, breathlessness, or flu-like feelings. Diabetics can have blunted pain signals and may not feel classic chest pain at all. If you're someone who falls into these groups, be hyper-aware of changes in your baseline. If something feels off and you can't explain it, don't dismiss it. This awareness isn't meant to create fear. It's meant to train your reflexes. When you recognize a possible heart-related symptom, your brain should jump to action, not to waiting. Another key detail, pay attention to the pattern and duration. If pain or pressure lasts more than a couple of minutes or keeps coming back, or if you have several symptoms together, like chest pressure plus shortness of breath plus sweats, that combination is serious. Don't be tempted to wait it out or take something for indigestion unless emergency services tell you to. Time is muscle. Every minute of delayed treatment risks more lasting damage to the heart. Recognizing the warning signs early is not panic. It's the start of your survival plan. Number 2, call for help immediately. This is the single most powerful action you can take. The moment you suspect your heart may be in trouble, pick up the phone and call emergency services. In many places, that number is 911. In others, it may be 112 or a local ambulance number. Give the operator your location. Describe your symptoms clearly. Say, I think I might be having a heart attack, and answer their questions. If you have a list of medications, allergies, or a medical alert bracelet, tell them. Put the phone on speaker so you have your hands free, and you can follow their guidance while you act. Do not attempt to drive yourself to the hospital. It may seem faster to jump in the car, but the risk of fainting or losing control at the wheel is real and immediate. Let trained professionals come to you. If you live in a building, try to unlock the front door or leave it open so EMS can enter quickly. If you have neighbors or a friend you trust, call them too. Ask them to come to the door and, if possible, stay on the line with them until help arrives. There are a few practical things to prepare ahead of time that make this second step much easier. Keep your phone charged and within reach at all times. Store emergency numbers in speed dial. Write critical medical information in large print near your main phone or on the refrigerator, and use a medical alert device if you have one. If you have a Prescription of nitroglycerin for angina. Have it within reach. If you've been instructed by your physician to take aspirin during suspected heart attack symptoms and you're not allergic and you haven't been advised against it, many emergency protocols recommend chewing an adult-strength aspirin, typically 300 to 325 mg, while you call for help because it can help slow clotting. But only take medications as your doctor has instructed and if there's no contraindication. These small preparations take minutes now but save critical seconds later. When you call emergency services, the information you give matters. Tell them your exact address, including apartment number or gate codes, your age, your primary symptoms, how long they've lasted, and whether you're on any blood thinners or heart medications. If you have nitroglycerin, tell them. If you've had recent surgeries or have severe allergies, tell them. Give accurate information so responders arrive prepared. Remember to keep breathing while you speak. Take slow, steady breaths so you can clearly communicate. If calling is hard, use a medical alert button, a wearable device, or an emergency contact who can call for you. The key is, don't talk yourself out of calling. It's always better to let professionals evaluate you. Number 3, breathing and the so-called cough trick. What to do with your breath and what to avoid. There's a lot of mixed information out there about coughing to restart the heart. Some reports describe situations in monitored medical settings where rhythmic coughing was used briefly to maintain circulation during certain arrhythmias. That's a very controlled environment with specialists watching. For someone alone at home, it's not a reliable medically sanctioned cure, and it should not replace calling for help or following dispatcher instructions. So I want to give you a balanced, safe approach. First, focus on calm, measured breathing. Panic increases your sympathetic nervous system response. Your heart rate rises, your blood pressure spikes, and your oxygen use goes up, all of which make the situation worse. Slow, deep breaths through the nose and gentle exhalations through the mouth help keep oxygen moving to your brain and vital organs and help you think clearly. Try breathing in for about 4 counts and out for 6 counts. The exact rhythm isn't as important as slowing the breath and staying steady. Place one hand on your chest and one on your abdomen. Feel the belly rise as you breathe in to make sure your diaphragm is working. Second, if you begin to feel faint or your vision tunnels, sit down immediately or lie down with the upper body slightly elevated. Don't try dramatic breathing maneuvers that make you lightheaded. If your pulse becomes irregular and you feel like you might lose consciousness, your priority is to keep yourself safe and to maintain a clear airway. If by chance you have been trained and are confident in advanced emergency techniques, follow those training steps, otherwise avoid risky tricks. If you've heard about rhythmic coughing, breathe in deeply, hold briefly, and cough forcefully every 1 to 2 seconds. It's worth understanding the limits. That technique has been used in clinical reports where the patient is under continuous monitoring because a cough can raise intrathoracic pressure and temporarily help blood circulate. But when you're alone, unmonitored, and in a real emergency, relying on cough-driven maneuvers is risky. It may give seconds, but those seconds are not a substitute for emergency care. In short, controlled breathing, staying calm, and getting help are your primary actions. Use cough techniques only if you're coached by EMS or a clinician instructs you over the phone, and even then, understand it's at best a holding measure. If you have nitroglycerin prescribed, use it exactly as your doctor instructed. Usually 1 tablet or spray under the tongue and then repeat per the prescription for the recommended number of doses while monitoring symptoms. Nitroglycerin lowers blood pressure, so sit down when you take it and avoid sudden standing. Only take nitroglycerin if a clinician has prescribed it to you for chest pain. It's not a generic first aid measure for everyone. And again, if you've been told to take aspirin by your health professional in the event of a heart attack and you have no contraindications, chew an aspirin while calling for help, as this can slow clot growth. Number 4, loosen tight clothing and stay still. When your heart is stressed, every ounce of extra effort your body makes consumes oxygen that your heart and brain need. That's why simple acts of stillness and removing restriction are so effective. Unbutton your collar, loosen your tie, open your top button, and loosen belts. If you wear a tight bra, unhook it or loosen straps if possible. The goal is to give your chest room to rise with each breath and to reduce any external pressure that could make breathing more difficult. Next, choose a safe position that both keeps your airways open and minimizes strain. On your heart, the most comfortable and effective position for many people during chest pain is sitting slightly upright, leaning back on pillows at about a 45-degree angle, or sitting in a firm chair with your feet on the floor and your upper body supported. Lying completely flat can make breathing harder for some people. Sitting fully upright might increase effort. The halfway position, semi-reclined, helps the lungs expand more easily and reduces the work your heart must do. Use pillows, couch arms, or the back of a sturdy chair. If you feel faint, though, and lying down is safer, lie flat, and if it helps and doesn't cause further discomfort, elevate your legs slightly to improve blood flow to the brain. The exact position depends on how you feel, but the goals are always to keep breathing easy, preserve consciousness, and avoid unnecessary movement. Do not try to walk around the house, climb stairs, or reach for items in other rooms. Movement increases the heart's oxygen demand and can worsen the situation. Keep your phone within arm's reach. If possible, unlock the front door and turn on a light so responders can find you quickly. Put a note on the door if you must, but if you're able, tell the dispatcher where you are in the house and whether they will need a gate code or key. Avoid exertion. Conserve energy, keep still, and focus on maintaining steady breathing while help is en route. Here's a less obvious detail that makes a real difference: set up for rescue. If you live alone, consider keeping a small emergency kit near your favorite chair or bed, a list of medications and allergies in large print, your medical alert card or bracelet, bottled water, nitrogly, sarin if prescribed, and a readily available aspirin if that's appropriate for you. A flashlight, house keys, and a note with contact information glued to the inside of a cabinet or fridge can speed things up. These are low-effort preparations that greatly reduce confusion under stress. Number 5, recognize the early warning signs before the crisis: prevention and preparedness. Heart emergencies rarely appear without warning. Your body often gives clues, whispers that, if heard and acted upon, reduce the chance of a sudden catastrophe. Unusual fatigue, breathlessness after light exertion, chest pressure that appears during rest or small tasks, palpitations, or new episodes of dizziness need attention. These prodromal symptoms can come weeks or days before a major event. Don't normalize a new pattern of tiredness or shortness of breath. Get evaluated by your doctor. Ask for an honest cardiac checkup, an electrocardiogram, blood tests if indicated, and a discussion of risk factors. Know your risk factors and manage them actively. High blood pressure, high cholesterol, diabetes, smoking, obesity, a sedentary lifestyle, and a family history of heart disease all raise the risk of heart attacks. The good news is that many of these risk factors are controllable. Take your prescribed medications, follow up with your healthcare team, maintain a heart-healthy diet, stay active within your abilities, and manage stress and sleep. Quit smoking if you can. Control blood sugar and blood pressure. Small, steady changes in lifestyle add up to large effects over the long term. If you live alone, create an emergency plan with your family or trusted neighbors. Tell them your medical story, medications, and daily routine. Decide who will check on you and how often. Consider enrolling in a medical alert service that allows you to press a button to call for help. Wear a medical ID bracelet that lists essential information like diabetes, allergies, pacemaker, or blood thinners. Keep a current list of medications and dosages in a visible place and in your wallet. Put emergency contacts and your physician's number in speed dial and write them on a visible sheet near your phone. These simple steps reduce wasted time when seconds count. Now let's tie these 5 actions together into a practical, easy-to-remember, single sequence you can rehearse mentally: recognize, call, sit, breathe, stay. Recognize the warning signs early and honestly. Call emergency services immediately. Sit in a supported semi-reclined position and loosen restrictive clothing. Breathe slowly and keep your mind calm, and stay put until professional help arrives. Practice saying this sequence to yourself even when you're healthy. Rehearsal builds mental muscle so that under stress your body follows a plan instead of freezing. I want to add a few real-world tips, from small to life-saving, that many people overlook. First, ensure your home has good lighting and clearly labeled entrances. If you live in a community with security gates or locked lobbies, put instructions for EMS somewhere visible or give your building manager a spare key with clear instructions. Second, Store your medications with labels facing out and keep a photocopy or digital picture of the prescription list on your phone. EMS can use this information. Third, learn hands-only CPR and keep in mind that if you become unresp, ONSIV and someone else is with you, they can and should start CPR until professionals arrive. Fourth, consider an automatic external defibrillator (AED) program in your local community center or discuss neighborhood access with your local health services. Early defibrillation saves lives. Let's be honest, there will be fear. That fear is normal and human, but fear can be reframed into focused action. When the alarm feeling hits, translate it into one word: act. Your actions are not about bravado, they are about protecting the years and memories you've worked for. If you live alone, tell someone about this plan today. Share it with a neighbor, a friend, or a family member. Teach them where your emergency kit is, how to get into your house, and what to say if you call them. The more people who know your plan, the faster help can arrive. I also want to talk for a moment about when to call your doctor versus when to call emergency services. If you have a sudden onset of chest pain, severe shortness of breath, fainting, or symptoms that suggest a heart attack, call emergency services first. Do not call your primary care doctor as the initial step. If you have milder intermittent symptoms over days, new and unexplained fatigue, gradual new shortness of breath, or recurring chest discomfort, call your doctor promptly to arrange an evaluation. But remember, if symptoms escalate or persist more than a few minutes, treat them as an emergency and dial for immediate help. Sometimes people fear being labeled as overreacting or burdening the ambulance service. Medical professionals would rather see someone call and be safe than delay and suffer worse outcomes. Every minute of delay in a true heart attack increases damage. Trust your instincts. If your body says something is wrong, act like it. A few more practical phrases to memorize for the emergency call. My name is your name. I am at your address. I am your age. I think I'm having a heart attack. I have chest pain pressure that started time. I am on list of medications. I am allergic to list. Keep it short and clear. The dispatcher will ask questions, so answer calmly and exactly. Say if you are feeling faint, breathing heavily, or losing consciousness. If you are alone, tell them that too. Before we close, some final thoughts on mindset and preparation. Being prepared does not mean living in constant fear. It means living with confidence that, should the unexpected happen, you have tools, a plan, and the clarity to act. That confidence alone changes outcomes. You will make better choices, call sooner, and follow instructions more reliably. For those of you watching who have family far away, set up a system of daily check-ins. Even a short text at a set time is enough for someone to notice if you're late and check in. Invest in a simple smartphone with an emergency contact widget or a wearable device that can detect falls or call emergency services. These technologies are not for the faint-hearted, they are for the wise. Thank you for spending this time with CoreHealth. If this video resonated with you, if you learned at least one concrete step you didn't know before, please do 3 things. Save this video for later so you can review it when you're calm, share it with a neighbor or family member who might also benefit, and write a short comment below telling us which step you'll implement first. If you live alone, tell us in the comments. I will keep my phone charged or I will put my medication list on the fridge. Small commitments create big protections. If you found this useful, please like and subscribe so we can keep making videos that help you live healthier, safer, and wiser. Remember this, in the moment of crisis, your best tools are simple: awareness, a clear call for help, steady breathing, and calm stillness. These things don't require medical degrees, they require presence and a plan. The more prepared you are, the less likely panic will become your default, and the more likely you are to survive and recover. Make that plan today. Tell someone about it. Put your emergency kit in reach. Practice the words you will say when you call for help. And if you ever find yourself alone with chest pain, act, recognize, call, sit, breathe, stay. You don't need to be a doctor to save your life. You only need to be prepared, calm, and decisive. Take care of your heart. It has carried you through everything else. Keep watching CoreHealth for more practical steps to protect your health and to help the people you love. Thank you for listening.